Hello everyone. Today we are going to learn about breast self-examination. Myself Vinoli, lecturer from Tribhulam College of Nursing. Let's get on to the video. Let's see objectives of the topics. At the end of the class, students will be able to understand about introductions about this breast self-examination, definition, purposes, guidelines and different patterns of breast self-examinations like clock pattern, wedge pattern, sweeping pattern. And steps in breast self-examination, there are 5 steps is involved in that. And signs of breast cancer, preparation, advantages and disadvantages of breast self-examination, and finally coming to the conclusion about the breast self-examination. Introduction. Breast self-examination can be taught to individuals or to groups. Breast self-examination is best performance after the menses, day 5 to day 7. For postmenopausal women, once a month can do, and many women have grainy texture breast tissues, but these areas are usually less nodular after the menses. Women should begin the practicing breast self-examination at their late teens or early 20s. So the nurses plays the pivotal role in preventing the education of breast self-examination. Definition. Breast self-examination is a screening method used in attempt to detect early breast cancer. This method involves a woman herself looking at and feeling each breast for possible lumps and distortions or swelling can be detected. Purposes: it helps to increase the breast awareness and also it helps to early detection of the breast cancer. What are the guidelines to be followed while doing the breast self-examination? So first, when to conduct the breast self-examination? Once a month by all women above 20 years of age group can be attended and should be conducted on a fixed date every month, and better to conduct 1 week after the menstrual cycle, and she is not menstruating, conduct the breast self-examination on a fixed date every month. And some of the patterns which is using for the guidelines doing the breast self-examination, that is circling, massaging motion, and follow the clock pattern or wedge pattern or sweeping motion, which means outer part towards the nipple. So these are the some patterns which is following guidelines for the breast self-examination. Let's understand clock pattern. First, visualize the breast as face of clock. Then place the left hand behind the head and examine the left breast with the right hand. Place the right hand at 12 o'clock at very top of the breast. Then place the pad of 3 middle finger firmly on the breast in slightly circling massaging motion. And move the hands down to 1 o'clock, then 2 o'clock, and so until return into the 12 o'clock. So continue the same pattern, moving hands in smaller circles towards the nipple. And place the right hand behind the head and repeat the examinations on the right breast. So while doing this clock pattern, check for tissue under the nipple and look for any discharges, and check tissues under armpit and surrounding the breast. The second pattern is wedge pattern. Here, first visualize the breast as a circle divided into wedges like a piece of pea. Then place the left hand behind the head and examine the left breast by the right hand. Then press the pads of 3 middle fingers pads firmly in slight circling and massaging motion. Then start at the top of the breast about half inch below the collarbone and slide fingers towards the nipple. Then examine the breast tissues in entire the wedge shapes and move fingers clockwise to next wedges until complete the breast and armpit. And place the right hand behind the head and repeat the procedures for right breast with left hand. Third pattern is sweeping pattern. Here place the left hand behind the head and examine the left breast with the right hand. Then instead of circling massaging motion, sweeping the 3 middle finger from collarbone to the nipple. Then, clockwise around the breast, sweep the fingers outside to inside towards the nipple. Then, to feel the deeper breast tissues, repeat the process using walking motions with the fingers. Then, place the right hand behind the head and examine the right breast using the left hand. Coming to steps in breast self-examination. So there are the three steps are there. First one is inspections on the mirror, and second palpation standing and sitting position, and palpation lying position. Step 1. First inspection on mirror. First stand and face the mirror with the arms relaxed at sides or arms resting on hips. Then turn to right and left for side view look. Then bend forward from waist and stand straight with the arms raised over the head and move arms slowly up and down at sides. And look for free movements of breast over the chest wall. Here, what you should look for after the mirror inspection. So first, breast that are their usual size and whether shape is any abnormal, and color, nipple any everted, areola whether even, axilla even, a color sometime if normal or abnormal, and without masses or rashes. Breasts that are evenly shaped without visible distortions or swelling. If you see any of the following changes, bring them to your doctor attention, like timpling, buckring or bulging of the skin, a nipple that has changed positions or an inverted nipple, sometimes redness, soreness or rash or swelling. So these are the symptoms if you findings after the mirror inspections can see the doctor. Step 2 is sitting or standing position. So first examine using the clock pattern or wedge pattern or sweeping techniques. Do upright breast self-examinations in showers, and soapy hands glide more easily over the weight areas. Then stand and press your 3 middle fingers to your breast and walking around the breast in the circular detection using your right hand to feel your left breast and then your left hand to feel your right breast. And use a firm smooth touch with the finger pads your hand, keeping the fingers flat and together, and use the circular motions above the size of a 1 rupee coin and follow a pattern to be sure that you cover the whole breast. You can begin with the outer edge of the breast and moving in smaller circles until you reach into the nipple. Step 3. Squeeze your nipple to check for any discharges, and this could be a watery, sometimes milky or yellow fluid or blood. In case of bloody discharge, see your doctor immediately. Step 4 is palpation lying position. To examine the left breast, place the pillow under the right shoulder and place the right hand behind the head, and this positions evenly distribute breast tissues. Then examine the clock pattern, check for any abnormalities, repeat the procedures for right breast also. Then next, feel your breast while lying down, place a pillow or folded towel under your left shoulder. This helps to your breast tissues breast evenly across your chest wall. Now repeat the steps second and third one. Cover the entire breast from top to bottom and side to side from your collarbone to the top of your abdomen and from your armpit to your cleavage. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circle until you reach the outer edge of the breast. You can also move your fingers up and down vertically in rows as if you were moving in lawn, and this up and down approach seems to work best for most women. Step 5 is finally feel your breast while you are standing or sitting. Many women find that the easiest way to feel their breast is when their skin is wet and slippery. So they like to do the steps in the shower. Cover your entire breast using the same hand movement described in steps 4. And what are the findings after doing the 5 steps of breast self examination? The first, redness of the skins on breast or nipple, bloody or clear fluid discharge from nipple, changes in feeling or appropriate skin nipple or breast like simply scaly inflamed one, and marble like area under the skin, and moss or lumps feel a small appeal, change in sizes, shapes, contour of breast, normal breast and nipples also will be changes. The changes can be signs for the breast cancer: elevation, asymmetry, bleeding, orange peel skin, nipple retraction, or sometime discharge. Preparation phase. First, the best time to do breast self exam is a few days after your monthly menstrual cycle ends, and hormonal changes can affect the size and feel of your breast, so it's best to perform the exams when your breasts are in their normal state. Women who don't menstruate should choose a certain day to perform exams, such as first day of each month. And you should also keep a journal of your breast self examinations, and this will help you track and record any changes you have noticed in your breast. Advantages of breast self examination: allows each woman control over her own health and provide each woman knowledge of what her own breast tissues feels like. It is a non-invasive procedure, simple procedure, and can detect the breast cancers at the earliest stage. Then, if a woman does not perform breast self-examinations, if the breast cancer detected in the early stage, it can be cured completely. A practice of breast self-examinations on monthly basis is very important for early detection of the cancer. Advantages of fear and anxiety about what may be found during the exams, and false positive, sometimes false alarm finding, which is a result that indicates that conditions are present, breast lumps or possible cancers when it is not a non-cancerous breast tissues. Coming to the conclusion, the evidence on breast self examination is clear. There is no benefit to breast cancer's mortality, and results suggest that breast self examinations may do more harm than good. I hope you all understand about this topic. Thanks for watching.